So Greg, let's talk about a few of the objectives that we're going to have today, like some of the questions that we want to be able to answer. I know that a lot of times when people look at sleep webinars, there's a number of questions that come up like, what is sleep? What are sleep and insomnia? Does cannabis really help improve sleep and insomnia? And if so, if it does, how does it work for sleep and insomnia patients? What cannabis cultivars or products help improve sleep and insomnia? And which products will also, with specific products, not just general, but very specific products, we should we be looking for. So this webinar is going to cover those particular topics. And so let's dive right into it and start with sleep. Greg, tell me about insomnia and how you treat insomnia.
Well, you can look at insomnia a couple of different ways. It's either sleep onset insomnia, to where you have trouble falling asleep. And if you have trouble staying asleep, it's a wake after sleep onset type of insomnia. If you wake up in the middle of the night and then have trouble falling asleep. And so we look at it as either an acute form of insomnia or a chronic form of insomnia if it occurs over a period of weeks into months. And some people have trouble that way of staying asleep.
Right. And a lot of people, it affects a lot of women more than men, and also elderly. Is that correct?
That is true, and there's a lot of different things that can cause insomnia that we'll get into later on in the lecture. But normally it takes about 15 minutes to fall asleep naturally. And you can be like a early sleep onset, and this can also be a problem if you fall asleep within 5 minutes or less. But if it takes you more than, say, 20 or 30 minutes to fall asleep, when you're actively trying to fall asleep, then we can consider that like a form of insomnia. It's the most common sleeping disorder there is.
Oh, that's great. So that begs the question, what is sleep? And, you look at pain and anxiety being the main reasons why people have trouble sleeping. From your perspective, how do you look at sleep? What is it?
When you think of sleep, everybody thinks of sleep as just some type of like a restorative form of like a temporary loss of consciousness. It's not true loss of consciousness that's pathologic, but it's more of you can consider it the opposite of a wake state. So when we look at sleep, there are different stages of sleep, and there's also wake state that people can move into and out of during the middle of the night. But restorative kind of a function of the brain is the way we always look at sleep.
Yeah, it's something that's, I think, very important for a lot of people. And we'll talk about that as we go along. One of the questions people always ask me when I'm doing this webinar is, why do we sleep? What's the reason for it? You had some pretty good answers here. Tell me why we sleep.
It's unusual because we look at it as if you don't sleep, you might live like 3-4 months or something like that. And there's some type of organic brain disorders where there's like a fatal familial insomnia, worst form of insomnia, where you don't sleep for weeks and months on end and you will die. So you look at that as like one end of the spectrum of like having problems, getting to sleep. And then the other one is like where you sleep too much. So there's short sleepers and long sleepers. And we always think of it as like from 4 hours a night to 12 hours a night. And everybody is usually right in the middle of about 8 hours a night, depending on how old you are. But if you're sleeping more than 12 hours or less than 4 hours a night, those two groups of people are dying faster than the guys that are in the middle. And that's why what we consider a normal amount of sleep for adults.
That's interesting. And also it keeps our nervous system functioning. It really helps us rejuvenate our bodies, right?
All the way around. When you're asleep, there's like a slow wave sleep. It's a pattern of sleep that we look at where they're actually like restoring all of the excitatory amino acids, glutamate, other chemicals around the neurons in the brain. Different like cell supporting kind of things are being taken up, like the astrocytes and glial cells supporting the neurons. It's like a big time to recover. And the recovery process is all of that, all of it's like going to get the neurons ready to fire and discharge during a wake state.
And that gets into how it helps us grow and how it helps us heal.
A lot of hormones are being released at night too. Yeah, absolutely. Growth hormone is released during deep sleep in the first third of the night.
That's a good point. You were mentioning duration. That has a direct relationship to your health. Is that correct?
Absolutely. When you think about, babies, pediatric patients, young adults, all of those need more sleep. So we look at like having sleep that may be broken up with 2 to 3 different naps during the day as an infant, till people don't take naps anymore, but they still need like 10 hours of sleep a night for like very young people.
Yeah.
Into adults, where you start to even off at that 8 hours a night, 7 to 8 hours a night. But incredibly important to get a right amount of sleep. And sometimes, for the most part, kids have what's called a limit setting disorder, where it's sort of the parents' fault for letting them stay up too long, where you really have to get on to them to make sure that they get enough sleep.
Yeah, it's really, really, really good for them. And of course, not getting enough sleep, you have a number of both mental and physical disorders. I find that very
It's hard to
interesting.
tell. Yeah, exactly. Like which one comes first a lot of times. Sometimes it's like the sleeping disorder precedes the psychiatric problem or other like problems with the health. And sometimes the health problem comes up first, and then you have sleeping disorders that sort of compound the entire illness. So it's, you try to figure out which one came first a lot of times.
Yeah, the chicken or the egg, kind of thing. But the problem is it's there. This is that graphic you were talking about the amount of sleep that we really need based on our age.
Everybody should look at this. Everybody should look at this, especially like when you're a young adult and you think you've got a lot of things going on, even until you're college age. When you're college age, you don't think that you need enough sleep. You're partying on the weekends and you think you can recover to have classes during the week. But if you're trying to arrange all of your class times later in the afternoon because you don't get to sleep at night, then you're academically doing it wrong. So you still need to get enough sleep no matter what age you are. And if everyone looked at this graph and tried to shoot for this kind of graph instead of social interactions and being on the computer and the internet, they do much better.
Yeah. I mean, if you look at it from the ages of 25 up, 7 to 9 hours sleep is really what you need a day.
Yeah, and when people think that they've gotten enough sleep, remember there's short sleepers and long sleepers, which if you wake up and you feel refreshed and you only need 5, 6 hours of sleep during the night, that works too. If you sleep 10 hours and things like that, that's fine. But if you're sleeping and catching up on sleep during the weekends and sleeping like 12, 13 hours on the weekends because you are short sleeper during the week, then it's not good. And, anytime the wake time differs by more than 1 or 2 hours every morning, then you're having issues. You should always like have your wake time like pretty much anchored. If you can have your wake time anchored, then your brain gets into that normal circadian phase. Very important.
That's interesting. Well, look, we talked about sleep and the circadian phase. Tell me a little bit. This is a very interesting slide. Tell me about this.
Yeah, I love this slide. When you look at it, you see the periods of wake and you see the periods of sleep, but that C curve is the circadian rhythm and the S curve is sleep pressure. And you can see the sleep pressure building up during the day. And as long as you don't take a nap that relieves some of that sleep pressure, and as long as you're on the backside of that circadian rhythm before bedtime, you'll fall asleep naturally. And most of the people with insomnia, they have trouble when that sleep curve and the circadian phase are asynchronous. When they go out of phase, and they have trouble falling asleep at the same time. But if they know enough, like I took a nap, so I know that I'm not going to go to sleep at the same time, they'll be okay.
Yeah, it's very interesting. So, and we heard, there's different types of sleep. We've heard of REM, non-REM, and REM and sleep cycles. Tell me about REM sleep, because that's an important part of the whole sleep process.
Everybody loves REM sleep, rapid eye movement sleep, where most dreams take place, not all dreams. But rapid eye movement sleep, it starts off about 90 minutes after you fall asleep, and it's short, maybe 10, 15 minutes long. And then every hour and a half to 2 hours after you fall asleep, there is a longer REM period. So we get most of our REM sleep in the last third of the night. And we usually remember our last dreams because that's during our longest period of sleep. Now, during rapid eye movement sleep, there's a flaccid paralysis. Everybody in dream state sleep is usually paralyzed so they don't flail around and act out their dreams, which is another parasomnia that is REM behavior disorder, which is unusual and it's pathologic. that you have to protect yourself from it. But REM sleep is good for psychological health, and you got to have dream state sleep.
Interesting. And this is what you pointed this out to me when we were prepping for this slide. Tell me about this slide. This is interesting. The different rhythms that are here.
You can't fake REM sleep on when you're looking at an EEG and a polysomnogram or a overnight multi-channel sleep recording. But you see the top two lines, left eye, right eye. A2 is just a cortical EEG reference electrode ground type, and you can see the phasic eye movements towards the right side of that curve, that line, and that's the eyes moving either in opposite directions or up and down, and then they have those phasic eye movements. Now, just before that, you see those sawtooth waves that are underlined, and that's C4 to A1.
It's right here.
It's just sort of like, the somatosensory cortex reference to like one side of the ear, but those sawtooth waves are indicative of rapid eye movement sleep as well. So you look for both of these, because you can have no eye movements and be, in a different type of REM sleep, because there's, the phasic REM sleep, and then there's the sort of like a non-eye movement type of like a REM sleep, but you'll generally always have those sawtooth waves.
It's really interesting. And this is
that loss of muscle tone on the right, the EEG, the electromyogram, you can see that dark line start to get a little bit thinner and not so bold a pattern. And that's the paralysis that's coming up with rapid eye movement.
That's interesting. That's interesting. So tell me then, if we don't have REM sleep, you have obviously non-REM sleep. I think you called it, some people call it N1, N2, and N3, right?
Correct. They changed the designation maybe 15, 20 years ago. It used to be stage 1, stage 2, stage 3, stage 4 sleep, with stage 3 and 4 sleep being deepest forms of sleep in the first third of the night. And then stage 1 is a light sleep where you could be easily aroused, and N2 is somewhere in the middle. That's also got some pretty interesting EEG components to that. But light sleep is generally what you get into first, the N1 sleep, and you could transition to different stages of sleep again in about 15 minutes. You'll go from like a alpha state where it's a 10 cycle per second alpha waves. And they used to think about that if you're trying to free your mind and not think about anything, you'll be in an alpha state. Close your eyes, relax, and don't think about anything. And then you'll be in an alpha state. And then you can see your eyes go through these slow rolling eye movements before you transition into N1 sleep, generally on sleep onset.
And the characteristics that you see in the non-REM sleep is, your body temperature lowers, your heart rate slows, and your brain uses less energy, which is what your body's doing to really basically rejuvenate itself.
Yep, you'll move through all of these different stages of sleep, and you can see, sometimes you'll see like heart rate variability in different stages of sleep. You definitely see the respiratory pattern altered in dream state sleep. And, we see different types of sleeping disorders depending on which part of the night. Right. Parasomnias, when you look at it, are interesting because you can grind your teeth in the first third of the night in deep sleep. Sleepwalking is usually in deep sleep in the first third of the night. And night terrors, nightmares, when do they occur? That's what some of the questions that we ask.
Interesting. And these are the different phases and the different stages of sleep and the characteristics of those that are there. I find it interesting that you said light sleep is 5 to 10%. Your light to moderate, more 50 to 55%, and then your deep sleep is like 20%. I find that very interesting. That's really the last third of the night when you're really falling in that deep sleep. Is that correct?
Well, the first third of the night when you're in deepest stage of sleep. And that's the most restorative stage of sleep as well. So if you get the deep sleep, restorative sleep in the first third of the night, sometimes you feel like you can wake up and keep going. That some people would think that, that's sort of like a power nap kind of stuff.
Right.
But, that's what we think of the restorative forms of sleep. And that's where we do a lot of like memory, setting memories down. And you can see these tall amplitude, slow 1 to 3 hertz waves that they're moving across. So the difference between N3 sleep and the old stage form designation is just more of these slow delta waves that you see during the night. And those are those really tall amplitude waves that you find.
Sure. Which is very fascinating. I just find this interesting because obviously we all sleep, but we don't realize how we're sleeping. It's really
Who
interesting.
gets the most deep sleep where you like you're able to like learn more things, the cognitive effects on is an infant. Who gets the least amount of deep sleep is the older people. So you can't teach an old dog new tricks kind of thing. It's actually kind of true.
Well, here's interesting because we've heard about circadian rhythms, biological clocks. Tell us a little bit about this.
You know, circadian rhythms, people like throw that term out there, but it's a very real thing. It's the body making proteins and breaking them down. There are actually genes that control things about when you're going to likely to be more awake and likely to be more asleep.
Mhm.
Clock gene, timeless gene, and those are making proteins. And then, you know, light can shut off or turn on some of the production, you know, some of these genes. So
Mhm.
that suprachiasmatic nucleus over there is a real structure inside the brain
Right
that
here.
is, you know, receives inputs from like retinal kind of stimuli. If you get like bright light, how to get you to cycle up on that circadian phase is with bright light to shut off melatonin production inside the brain, and you cycle up, you know. And if you're in a dim environment, to a dark environment, when you do go to sleep, that what you get is that increase in melatonin production inside the brain that helps with sleep onset. And that's why it's an over-the-counter drug. More is not better on melatonin. You know, somewhere around 5 milligrams or something like that is one of the best doses for, you know, shortening up the sleep onset latency.
Right. And your biological clock really is regulated by your circadian rhythms.
Yep, and that's what they were finding. You know, a lot of those things about like controlling sleep wake state. There is almost like two different pathways inside the brain for controlling the wake state and controlling a sleep state. It's
Mhm.
like a seesaw. You know, which neurons are overriding the other neurons to say we're more awake now, or the other side of the coin is the other neurons that suggest that we're asleep now. So you can see like when they're having problems with that kind of like sleep wake state control is in narcolepsy, another sleeping disorder where an excitable state like a quick like fright or surprise can send somebody bam into like a REM type of sleep
Mhm.
where they can't move, they're paralyzed, but they can almost hear what's going on around them. In the, you know, they know that somebody's calling 911 and getting a EMS services out there, but they're saying, no, I got narcolepsy. In their head, they're saying that,
Yeah.
and you know, and they're just out, and then they wake up on their own.
That's kind of interesting. So uh, when you take a look at helping yourself identify how you sleep better, there's a process you go through. Is that correct?
You know, yeah, everybody can. They could take a look and download this Epworth Sleepiness Scale, and they can answer those questions on the right side of the screen. So where you have 0, 1, 2, 3, when your chances of sleeping would be more likely. So if you always doze off watching TV, you would score yourself a 3 on
Mhm.
that side. And we look at like something over 10. You know, if your Epworth is over 10, we're looking at sleepiness. And if you're really high up there at 18, you might be severely sleepy. And
Mhm.
sometimes it's the only scale we got. It's sleepiness is like pain. You know, 1 to 10, how much pain are you in? Well,
Mhm.
here it's like, you know, well, you know, 0 to 20, how sleepy are you? So some
Right.
people, it's like, well, I don't go to the movies, so I don't doze off, and I don't ride in a car, so
Mhm.
they score themselves 0, and that thing's thrown off. But if
Mhm.
you ask these questions that are over here on the left side, you get the idea if you need to speak to a medical professional about whether or not you're sleeping well.
Mhm.
So best thing, and for most people, if you wake up feeling refreshed, you have energy through the day, most likely doing okay. But if you don't think that you are, and you have that occasional problem, ask yourself if it's affecting your life. Is
Mhm.
problems with sleep affecting your daytime function? And then you think about, well, do I need to have a test? Or do I need a medication? And you know, then you talk to a sleep professional generally. You know, you can
You know,
start with your primary care, but you have to go to a sleep clinician to find out, you know, it's like, okay, what could it be? Because
yeah.
if you go into a doctor's office and say, you know, I want Valium, it's like, well, that's not going to work. You know, first they're going to ask you about sleep patterns. What do you
Mhm.
do? What happens? And then you might have an overnight sleep study. to find out what's going on. And then, we'll start answering the questions together is usually how it works.
Sure. And I think it's important to point out, if you're having trouble sleeping, look at some of these questions are ones that you're having trouble answering, go see a professional. A lot of people don't realize how important sleep is. It really is one of the foundations that really provides not only the health, but also your mood, your consciousness, how well you function in life.
How you interact with other people. That's one of the things that we look at. Are you overly aggressive or overly shy? Even for kids, for pediatric patients. Yeah. If you start looking at them and how they perform in the classroom, they did a study one time in the New Orleans area, and all the kids that they thought they had like a pediatric form of sleep apnea, a part of them got the tonsillectomy, adenoidectomy, and part of them did not. They elected to not have the surgery. Well, the guys that had a TNA, the tonsillectomy, their grade performance started to shoot up. And the other guys that did not, they stayed kind of flat in the lowest 25%.
That's interesting.
And it was like, okay, the kids got to sleep well so they can perform well in school. And that's what they were really looking at. And this happens, across the board. It doesn't matter how old you are. So sure. Sleeping is definitely a thing.
Well, the question becomes, what research has been done for cannabis, cannabinoids, and sleep? And really what has been done is there's been a number of research posts as well as articles and studies that have been done. And what they're really finding is, we're going to talk in a moment about the endocannabinoid system, the ECS, but it really has a huge role with circadian rhythms. It's something that really plays a large role. And the endocannabinoid system is the regulation part of your body that helps your body be able to control the functions like mood, sleep, appetite, pain, those types of things. And so we have found that there is a direct correlation between the endocannabinoid system and circadian rhythms. They've also found that THC has been shown to have a lot of sedative properties and help people reduce sleep apnea. I find this interesting because one of the things that I talk to a lot of people about is they have trouble sleeping at night. I recommend that they take a gummy, because gummy or chocolate before bed, about 2 hours before bed. It'll help them it takes about an hour to an hour and a half for it to work, but it'll work for between 6 to 10 hours, probably more like 8 to 10, and they'll get a good night's sleep. And it's very, very effective. I've had a number of patients that have come to me and said that's probably the best tip that we've had that's out there.
And using it as a medication, as it should be intended, it's it's safer. But a long time ago we had barbiturates. It was like a lot of overdoses were happening, and then we moved to the benzodiazepines, Valium class of medications, which has a very physical, addictive kind of effect. And if you stop taking it, you can have major problems if you stop taking it just cold. Right. And so then they came up, the other things that are out there, and that they work on the same type of receptors. And they say it doesn't have as much of, that kind of effect, but so we're moving around with trying to find a medication, and something that's working on the endocannabinoid system is it looks like it's having almost more of an immediate effect depending on the delivery system, and how it works on the endocannabinoid system to shorten that sleep onset time, the sleep onset latency they call it.
Right. So and using CBD and THC together has a great therapeutic effect to help people, with both slow wave sleep and also to help onset of sleep. Is that correct?
And I really do think so. It's that combination of a receptor physiology. So which type of drug, which side of the THC or CBD that you put into the drug that acts on the system and different receptors. So, there's some, depending on what you have now. I would always start with this traditional Western medicine, look at behavioral activities, look at everything else first to make sure that you're doing it the right way. Rule out things like obstructive sleep apnea that you may need to fix, because that has a higher risk of heart attack, strokes, and accidents associated with it. And you don't want to mask that with medications. Right. But once you're there and you can find some occasional forms of insomnia that you need something, this really does work, as long as you're not trying to overdo it. And it really does help with pain. And a lot of people don't know that you can see pain during the night when you're asleep on EEG. So I can look at somebody's brainwave patterns and you can see this alpha delta sleep during the night that, it's like, well, then pain is a problem. It's causing these arousals during the night. And you wake up fatigued first. And if it gets worse, then you wake up feeling sleepy and you could doze off during the day. So,
yeah. What's interesting is this, one of the studies done in Colorado when cannabis became recreational, meaning people could buy it over the counter. Sleep aids fell, the purchase of sleep aids fell over 200%. Now, this is an anecdotal study. This is just something that says, all right, here's a cause and effect, but it's interesting to look at that correlation based on a lot of the information you're providing.
oh yeah, and I think it's a great thing because, if you can use this, use it for occasional, like, insomnia, or when you know that you have to be on your game the following day and you're all keyed up and you don't think that you can get to sleep without a little something to push you over the edge. Remember, sleep pressure built up during the day on the backside of the circadian phase, and sometimes you need that little bit extra to push you over the edge to fall asleep, and it's perfectly fine that way. But if you knew you took a 2-hour nap during the afternoon and you're trying to go to bed at 9 o'clock at night, and you want to medicate yourself with this, not the best thing to do. I would wait 2 hours past your normal bedtime and then use this maybe to help push you over the edge to fall asleep.
Yeah. It's an interesting study, and it's an interesting correlation that's really out there. And what's interesting is, again, we're going to talk about the endocannabinoid system in a moment, but what they have found is that the endocannabinoid system really helps to be able to maintain a lot of the functions of your body, your mood, your appetite, sleep, and really regulating your circadian rhythms.
Oh yeah, it's something that's coming out more and more the more research they do into it, and the more widely accepted it is. I mean, there's political pushback, there's everything else, but a lot of the medical staff are looking at this as like, no, this is something that we've seen it work. Now we have to figure out exactly how it does it, and then we have to look at how we administer it to people that really need it. And with it coming out as being a recreational type medication too, everybody that's using this purely as recreational, that are overusing the amount of cannabis they use every day, it actually causes a REM sleep suppression. And they have to be careful about that because you need dream state sleep, but cannabis can alter the amount of dream state sleep you get, and not good. So everybody, within moderation with everything, occasional insomnia, good. But if it's more and more, and that you're doing it more and more and calling it for insomnia, that's when you need to go speak to your physician or health professional.
And also, if you take a look at CBD helps decrease anxiety and pain, and that reduces pain by basically reducing the amount of inflammation in your body. And if you reduce the inflammation, you're basically reducing the pain. So it's something that I wouldn't say CBD affects sleep directly, but by decreasing anxiety and decreasing pain, what it's doing is it's basically helping you get a more restful sleep.
Absolutely. Anxiolytics on a low dose, looking at benzodiazepines, it reduces anxiety on a low dose, reduces it can cause a hypnotic effect at a higher dose. But again, it's a drug that's physically addictive. So when you look at CBD that can have that same type of effect without all the physical addictions and the problem associated with it, then that's exactly, what we should be going in the direction we should be going in.
Sure. Now, we talked about the endocannabinoid system. Let's kind of define it for a lot of folks because it's probably a new term and a new concept for a number of people. What I find amazing is that, well, ever since I was a child, I heard about the nervous system. And I kind of look at the nervous system, I call it the cell phone system of your body. If you have a problem with one part of your body, your nervous system calls your brain, says, Houston, we have a problem. Whether you hurt your finger, sprained an ankle, have an internal problem, your nervous system is something that lets your brain know we have a problem that's there. What's fascinating to me is that Western medicine studied the nervous system for a long time, but never answered the question of, when you say, Houston, I have a problem, to the brain, what did Houston do with it? That's what I found absolutely amazing. What happened was when they started studying the cannabis, they found that the body has an endocannabinoid system. This was found in the 80s, and it really was identified in the 40s, really brought to light in the 80s, and in the 90s, it really was put in the forefront that this is something that parallels, works in unison with your nervous system. So when it says, Houston, we have a problem, your brain hands this to the endocannabinoid system, and your endocannabinoid system says, okay, I'm going to produce endocannabinoids to address whatever part of the body that I need to address. And I do that through a series of what they call CB1 and CB2 receptors. And you can see the lighter ones are the CB1 receptors. Those are in your brain, typically in your spinal system. CB2 receptors are are basically in the middle of your body, in your gut. But it's interesting that this is how your body manages itself. If you have pain, your body produces endocannabinoids and it sends those through your bloodstream to that part of the body to reduce the pain. And I just found it amazing that this was overlooked for so many years when it was something that I thought was very, very important.
Yeah, it took them a long time to get through to all of that. I mean, before they were looking at, the body's endogenous opioids being produced from the POMC, pro-opioid melanocorticotropic hormone, that's broken down to like various bits that the body can use for things like that, runner's high, but now they're looking at the different receptors, the CBD1, like you said, CBD2. So they're trying to find out what is sticking to which receptor and what kind of effects it has.
Right. And what's fascinating is that there's over 200 known cannabinoids in cannabis. It's probably the most, let's just say it is a plant that acts as a medicine. It is not a drug. It's a medicine. It's been there. And our body produces endocannabinoids. We do that naturally. But what's interesting is the cannabis plant has what they call phytocannabinoids, and those phytocannabinoids mimic the endocannabinoids. In other words, they're almost structurally identical to our endocannabinoids. So let me take myself as a senior citizen. As I get older and my body's not producing endocannabinoids either as much or as fast, by having some phytocannabinoids in my body, what you're able to do is you're able to give your body the resources it needs to be able to address a particular situation like pain or inflammation. And it does it a lot more effectively than it did before. I found this very interesting. Why cannabis is a big deal? Because it parallels and matches the processes that go on within your body.
Oh yeah, it can add to it, but like all receptors inside the body, if you flood it with the same type of like a molecule, then some of the receptors will fade away. Then you need more and more and more of that medication to sort of get the same effect. So you have to be careful with that. If I had to say that one message, it's moderation again. You don't want to affect your entire endocannabinoid system by suppressing the receptors that are on the cell surface by flooding the system all the time. So if you truly have some acute insomnia here and there, or if you truly have a pain that you want to use this kind of thing to just help you get through the pain, without using opiates, which can cause a host of other problems, then I think this is a good way to go. As far as, when science figures out which ones do which and have which kind of an effect. And so all of that's got to be teased out, and, everyone's working on it now, I think.
There's a lot of research going on. By the way, I wanted to point out, when we look at cannabis, the little trichomes that are in here, that's what it's all about. That's what the whole thing is all about. Those little trichomes are where those hair-like structures in the cannabis plant is what really provides the medicinal value that's out there. Now, what's interesting is that if you look at cannabis, cannabis is really a whole medicine cabinet for us. What it is it provides 450 medical properties, 120 cannabinoids, but more importantly, if you look at the left-hand side over here, there's a lot of cannabinoids in the product. As we mentioned, there's over 120 that we know of. There's 200 that they've discovered. They work together. In other words, 1 and 1 is 3. In other words, you have a THC cannabinoid addressing sleep. You have a CBD, like a CBN cannabinoids addressing sleep. And when they work together, 1 and 1 in essence is 3, because they're really synergistically working together. That's what the magic of cannabis is all about.
Oh, and that's why I like the idea of, speaking to a professional from the cannabis side that says, okay, let's try to mix some of this or put some of this with this and with this. and
Right.
see, individualize sort of like that kind of a treatment to find out, what that one person needs, and then find out what the effects, how did you feel, and then make adjustments as you go.
Right. And again, I'm just showing you only 6 of the cannabinoids that are out there, but I just want to have people understand that there's a lot more of them that are out there. What's interesting is we talked about the CB1 and CB2 receptors before, and here is where you see the CB1 and CB2 receptors working with THC and CBD. But what they have found over the last 6 to 8 months, actually, I'm sorry, 18 months, is that CBD actually affects a number of other receptors down here, Greg, like the serotonin.
I see serotonin up there. So when you look at some specific types of like receptor physiology that affect like mental health, where they target some different like receptor populations,
Right.
and CBD, also has an additional effect on top of them. I think it's when they find that kind of coordinated approach, that you really use a human physiology to find the best medication for an individual patient.
Right. I mean, CBD has really been shown to be almost a super vitamin, and working with THC, it does some miraculous things, again, with sleep, with pain, with inflammation, blood pressure.
And it's titrated. It could be titratable. That's why a single pill for all this, is tough. When they came out with Marinol, that has like 5,000 times the affinity for these receptors than a titrated product where you can like modify the dose, and that was critical. Some people is like, I can't take that Marinol stuff because it just floors me and I'm useless. And so that's why it's like you had to take that thing out of the loop and say that, okay, this person, that is not the right medication to give that person.
Right. You need that CBD to have everything really work together. I put the slide up only so, and it'll be in the deck. As I mentioned when we began the webinar, that everyone will get a copy of this deck as a follow-up in an email. But just wanted to show you the cannabinoids that line up with the different receptors. It goes back to what you were pointing out, Greg. They're really finding out a lot about how the different receptors are affected and how cannabis makes a big impact on that. And this is just a good example of what the research that's been done. But what also is interesting is we have found over the last couple of years, that when I first got involved in cannabis, they talked about indica and sativa. And then all of a sudden we switched over to talking about strains, this strain and that strain. And then what's interesting is we've discovered that there's terpenes that are in the strains, and the terpenes really are the part of the cannabis plant that brings the medicine, that brings that medicinal value that's out there. And so when you take what cannabis producers are doing today, a lot of the dispensaries that are producing and the cannabis producing entities, they found that by identifying the different terpenes with the strains, it gives the particular product what they call a chemical fingerprint, and they call that a cultivar or a chemotype. In other words, what is it designed to do? Is it designed to help with sleep? Is it designed to help with pain? Is it designed to help with inflammation? And what's going to happen, I think, in the next 5 to 10 years, is you're going to actually have cannabis products labeled to be able to address particular situations. Right now, it's kind of a bit of magic because we're kind of learning a lot about what it all does.
It's all anecdotal evidence. Everybody's like taking in feedback from the individuals. It's like what I've heard, this works from what I've heard. When you get enough of that, it says, okay, this terpene for that kind of a problem right there. And, that's where science needs to like start and like put some data behind it, some real data behind it. And that's what they've been working on.
And there's a lot of research. There's more research going on right now in medical cannabis than has been done in all recorded history before. So there's a lot of research going on right now.
20 years ago, when you look up medical marijuana, cannabis, you didn't see anything. But then you look up anandamide. Mm-hmm. And then anandamide opened up all the research. It's like they tried to hide it, and now it's like CB1, CB2 receptor physiology. It's like, okay, there's a different way of looking at it, and it's around, or everybody understands what it does to them, and so it's a different spot where it is.
And as we mentioned, what you really want to find is your sweet spot. You mentioned earlier, if you take too much, more is not necessarily better. You want to be able to take enough, go low, start low and go slow, take a little bit, and you'll begin to feel better and better and better. And then at some point in time, you may be taking too much and you start pushing yourself down the edge a little bit. We'll talk about that in a few minutes. but you really want to be able to go low and go slow. Your body will tell you that you're feeling better. You don't need a doctor. I know in my particular case, when I have herniated discs in my neck, when that pain starts going away, when I feel better. And I know that if I take a little bit too much, the pain starts coming back. So I know exactly where my sweet spot is. And that's why it's called a sweet spot, because you have to just listen to your body. Your doctor really can't tell you. A lot of people say, well, what should I take? We can tell you the type of cannabis to take. We can't tell you how much, because every person's body is really different. Now, we talked about terpenes a little while ago. These are the top 6 terpenes. Now, again, there's over 100 different types of terpenes that are out there, but you see a lot of these terpenes, whether they're myrcene, linalool, caryophyllene, humulene, terephthalene, and pinene, all of these have a particular characteristics. And you'll notice down here, it has a lot in reducing anxiety, for example, reducing inflammation. Over here, it helps reduce pain. Each of these has a medicinal value. And by the way, when you have a cannabis strain, it may have a couple of these. In fact, it may have as many as 20 or 30 of these terpenes in them in that particular product. It depends on the concentrations, and the main concentrations we find are in things like myrcene, linalool, and caryophyllene. So terpenes are important. And there's going to be, by the way, I just want to point out, next week, there'll be a webinar. I'll do a webinar on terpenes by themselves. We'll discuss them and what they can do. This is a very important part of cannabis, and I just want to point that out. Now, people ask the question, what strains should I use? And again, I'm going back to using the word strains from the standpoint of cultivars. And we've noticed that all of these dominant terpenes, which is myrcene, are found in a number of different products. And for example, if you look at Granddaddy Purple, it's been reported as an indica, it helps you sleep, but it's very high in THC. It's over here. And that I find very, very interesting, that all of these products that help you sleep have a higher concentration of THC than CBD. It's out there. But these are some of the strains that you can look for, and you'll find them in almost every one of your dispensaries that are out there. Feel free to talk to your dispensary. I would recommend you talk to if you're looking at sleep, I'm going to go back up here, go into your dispensary and ask them for something that has myrcene, linalool, and caryophyllene, or what they call beta caryophyllene or caryophyllene. All of those will help you. Sleep significantly help you with sleep. That's out there. That's there. There's also another cannabinoid called CBN. Greg, are you familiar with CBN? I don't know if people have talked to you about that or not.
You talking to me?
Yeah.
Oh, just what I've read, and I read a bit on CBN receptors and receptor physiology, but not enough to say anything that definitive. Some of the disease states that they've looked at it with and things like that.
Yeah, one of the things I've been researching, especially the last 2 years, but more over the last 6 months, is they've done a lot of research into CBN and what makes CBN kind of magic. Well, it does a couple of things. One is it is not intoxicating. A lot of the products, like the THC products, what happens is that they can get you, they kind of have a euphoric effect. CBN does not, but it really, really good for things like pain and insomnia. A lot of people that have pain problems or insomnia look at CBN as an alternative that's out there. And when you use CBN with THC and CBD, and also I mentioned that those sleepy terpenes, linalool, myrcene, also humulene, you'll find it is very, very effective at helping people sleep. That's out there, and you're not going to get high. And you mentioned earlier, I have a meeting in the morning. I'm having trouble sleeping. I'm a little anxious. CBN will do a great job, especially with a little bit of THC in it. What'll happen is it'll help you sleep for the night, and when you wake up in the morning, you'll wake up refreshed. So when people ask what strains I should look for, I recommend CBN as one of them that's out there. There's a lot of research that's been done, and it's really coming to light for a lot of people. Now, Greg, you mentioned earlier about how to take it. I mean, we have for a long time been doing what I call the oral version, taking a pill and that type of thing, which typically when you do something orally, goes in your stomach. It takes about 30 minutes to 2 hours to have it work. I know in the case of cannabis, you have to be very careful with those edibles and those gummies, those chocolates and those capsules, because if it takes 2 hours for you to work on your body, about the time you think it's not working, you'll take another one and you'll probably be taking too much. Is that correct?
That's right. Yeah, that's why, a different delivery choice if it's a insomnia that you're looking for the effects, feeling the effects, while you're ready for bed. So,
Right. Yeah. Well, what's interesting is they're very effective, especially like I mentioned at bedtime. You can see that at 4 to 10 hours, that it's really great. But we hear there's a lot of talk about edibles. Be very, very careful of edibles. If you take an edible, wait an hour, maybe wait 2, because it's very easy to take too much of them. I'm a big fan of sublinguals, where you take the drops and you put them under your tongue. They work in between 15 to 30 minutes. In my case, they work in about 20 minutes, and they're good for 4 to 6 hours. And when I wake up in the morning, the first thing I do is I actually take a sublingual. It's really not true. I shouldn't say that. First thing I do is I take a hit off of my vape pen to help get rid of the pain, because I have herniated discs and I wake up in pain. And so I'm able to get rid of the pain right away with the vape pen over here. It works almost immediately. It will last only 2 to 6 hours. But as it works immediately, I can then take the sublinguals. And while the sublingual is starting to work, the vape pen will help me be able to get to a point where I'm not necessarily in pain.
And that's what I like about that inhalation. If you don't have like pre-existing like lung disease, or your lung function is normal, where you see that average onset is immediate, very true. I tried like a vape pen once in California, and I was like ready to get into bed and go to sleep. Took like one hit off of a vape pen, and I was asleep within like 5-10 minutes.
Yeah, that works very, very effectively. And that's where inhalations. Now, I recommend if people look at flower, and by the way, in 2 weeks, I'm doing a webinar on dosing. So please feel free to join me, because we're going to talk all about these different ways, different routes of administration, what dosing you should be taking, what and when and how. That's what we're going to answer in 2 weeks. We're going to take a deep dive into that, because that's a whole subject in itself. But really, you really want to take a look at concentrates and vape pens where you can control the temperature, because what that does, it brings out the richness of the terpenes. Where if you just take a blunt, a joint, light that joint, that 500-degree temperature from the flame will burn off half of the cannabinoids, all the flavonoids, all the terpenes, and you're reducing the medical value of that joint about 60%.
Yeah.
That's
You're changing like the molecular structure of a lot of those when you start adding flame. Yeah.
Yeah. The good news is, even though it's reduced 60%, it's still effective. That's what we find.
And it is. Yeah. And it's not as immediate as a vape pen, but it is pretty quick.
Sure. Now, the last thing, I think another way you can take it is what I call topicals. We put it on your skin, and there's really 2 different kinds. There's ones that are called transdermal, that gets through the blood-brain, that gets to the blood barrier, gets right into your bloodstream, or gels that go on and just do the surface. And I prefer the transdermals when I'm having some problems right now with arthritis in one of my fingers, and I find my transdermal lotion helps quite a bit to be able to help me, because I do a lot of typing on the keyboards and things like that are out there. So we'll be talking about this in depth in 2 weeks, but we wanted to have you understand there are different routes that you can take in order to be able to use medical cannabis. Now, I decide I want to do this. Where do I go? Well, you can go to a dispensary like INSA here in Florida. You can also go to a doctor, a Florida medical card location like MMTC of Florida. They'll actually help you get your card. And then also, if you're looking for just CBD products by themselves, a lot of the dispensaries don't carry those. So what we did was we put together a website called My Botanical Wellness. And what we do with there is we actually researched all the quality hemp products that are out there, put those together so that you know that what you're buying from us matches what's in the label and what's inside the bottle match. That CBD is an unregulated industry. So it's important that you buy from a quality vendor that does the studies. We have all the studies with all the products that are out there. And so we're very religious about making sure there's a healthy choice that's there. So Greg, and I should point out with MMTC and My Botanical Wellness for watching this webinar, there's a coupon code, MMWW10. It'll be in your email that you get. They give you a 10% discount off any of the products that are out there. So Greg, the bottom line of this is we've talked a lot about sleep, how it works, what the alternatives are, how cannabis can help. The bottom line is that you're not going to you are in control. You're not going to get uncomfortably high. You're not, unless you want to. You control how much you take. And that's why we say go low and go slow. Don't take a lot of it right up front. Get used to it. feel how it works, let your body tell you if it's working and providing the relief for the symptoms that are out there. Greg, we also have, you've seen some research where medical cannabis is not addicting, right?
Yes, it doesn't have that physically addictive kind of property, but psychological addiction is still there. You know, it's like those other medications that, like Ambien, that's out there. It's not physically addictive like the benzodiazepines, Valium is, but it does have that psychological addiction. And so you still have to be careful with what you're doing. And, recreational use can go too far. So you have to be careful with all of that and try to remember that you don't want it to affect your sleep staging that much on a chronic basis. So take a drug holiday, and if you notice something like, oh, I noticed I started dreaming more, that's a REM rebound effect that happens when you're coming off some of those different medications. So you have to be careful.
That's a good point. I know every 4 to 6 weeks, I try to take 2 days off of using cannabis for 2 reasons. One is you mentioned that holiday, but also it tells my body gets used to getting cannabis, so it gets lazy. It reactivates all of those, that endocannabinoid system to produce the endocannabinoids that I need. Ideally, I'd like to take 4 days off, but in my particular case, my herniated discs, after about a day and a half, tap my shoulder, my neck taps my shoulder and says, you better do something pretty quick or the pain's coming back. So I'm not addicted to cannabis. What I'm addicted to is getting rid of my pain.
It'd be pain-free. Absolutely. And that's the whole point of it, is like when it does have that kind of medical effect, I think it's a great thing to do and to look at. And for all the recreational guys too. I mean, it's another great thing that people can do, and they get away from like inhaling it to keep their lungs clean. They go more to edibles. That's fine too. But when you're looking at insomnia and treating acute forms of insomnia, I think the inhalation route, when your lungs are disease-free, is a good way to go.
Yeah, exactly. So I do want to point out to everyone, if you're looking for stories about medical cannabis, if you have used medical cannabis, please tell us your story. Tell us how it worked, good and bad. We have a site we put up. We want to be able to chronologize all the different stories that are out there, so people can actually look and see how this works, what's worked, what's not worked. And that's what the I Got My Life Back, IGMLB website is all about, is really, if you're using cannabis, please tell us your story. If you're trying to look at stories from other folks, please go there and check it out. I mentioned earlier about My Botanical Wellness. First-time buyers get a 20% discount. And of course, you get a 10% discount for watching this particular website. In fact, I'm sorry, it's a 15% discount. I made a mistake earlier. That's something that's there. Please, it's MMWW15, and that will be in the email that you get as a follow-up. So Greg, this was part of a webinar series that we've been doing. We're doing sleep, and then I mentioned terpenes and dosing that's coming up in the next 2 weeks. Let's kind of recap. I think we've answered most of these questions. You got some comments on this?
I think we've gone over all the points, and I think we hit some of the points like 2 or 3 times when it was that important that everyone should know. So I think we're good.
Yeah. So I think what we need to do now is, why don't we answer some questions? I know we had some questions that were submitted before this webinar and some questions that have come up during the webinar. So let's jump into that and let's go answer those and be able to get some answers for our viewers to their questions. So what I'd like to do is I'd like to start with answering some of the questions that you brought up from the Q&A. One of them is, let's start with Rita's question. Rita's question is taking RSO and let's see, I'm taking RSO and don't have any dreams. Are you going into REM sleep? Greg, do you want to take that one on?
No, only because I don't know that much about some of the specific forms of medical marijuana.
Okay, well, RSO is whole plant medicine. What it is, it's Rick Simpson oil. It's very effective, and it's very effective for sleep. I know that in many cases, it will in fact give you a deep sleep. What's happening is, I think Greg had mentioned earlier about the deep sleep in the beginning of the sleep process. I made a mistake and mentioned it was at the end. I think it's at the beginning. Is that correct, Greg?
That's correct.
Yeah.
Deepest.
So what's happening is, sorry.
No, that's all right. You're correct. It's deepest sleep, restorative sleep, stage 3 or N3 sleep. Stage 4 is all in the primarily in the first third of the night.
Right. What I'm trying to point out is that RSO helps you get that deep sleep. And so therefore, what's happening is you say you may not remember your dreams. You're having dreams, but you're not remembering them because it does give you that deeper sleep. And RSO is a very effective cannabis product for sleep. And so you are getting, again, you are getting the dreams. You're just not remembering them. I think that's important. Angela had a great question. Does medical marijuana help people with narcolepsy sleep? You want to take that one?
Yeah, the idea is still it can, but narcolepsy is an interesting type of like a sleeping disorder because it's actually got components of a little bit of everything. There's daytime sleepiness. There could be some cataplexy where that's the ha 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 and then you're out kind of thing. And there's hypnagogic hallucinations that you may see things that aren't really there. So there's several things that keep going on, you know, with it. But if you just look at it as like a titratable, start really low, and always consult with a physician that is treating the narcolepsy, which you should have some kind of sleep professional looking at narcolepsy. But I think it can help.
Sure. I think the next question, which is good, it's Deborah's question. Why don't you take that one, Greg, about how I think maybe I confused her about deep sleep?
Yeah, it's something that's come up with a lot of people, you know, over the years. They think that dream state sleep is the deepest stage of sleep, was the exact opposite of what it really is. But that slow wave sleep of about 1 to 3 cycles per second, where all the neurons are discharging slowly together and rhythmically with a slow frequency, that's the restorative side of sleep. And that's also the most, it's not easy to arouse somebody from that deep sleep. If you're shaking somebody and shaking them and they don't wake up, and then they wake up confused, they were in that deepest stage of sleep.
Right. Michael asked a great question. It says, I use indica for insomnia, for PTS, and also for spinal problems and causing much discomfort all night. Does indica exacerbate the pain medication I use? First of all, I want to step back and say THC and CBD come in a couple of different forms. One of them, based on the terpene profile, will give you an indica feeling, which is an indicouch, a relaxing feeling, and one of them sativa, which is just energizing. What you're talking about really is the THC, which is helping you sleep and also helping with PTS and the spinal problems. Now, if you take too much THC, it will exacerbate the problems that you have. In other words, it'll bring back a lot of the pain. Cannabis is biopic, meaning as you go low and go slow and you use more and more of it, you'll feel the relief. Then if you start using too much and you're going down that curve, what's going to happen, the curve of use, it's going to actually bring back some of the pain. So the recommendation would be to cut back a little bit on the amount of cannabis you're using, but I also take a look, cutting back a little bit on the pain medication. Your thoughts on that, Greg?
Well, you have to be careful when you're working with a pain specialist because they try to control everything that you take. And I know that you can be discharged from practice if you're using combination drug therapy that they don't know about. So one thing, any form of cannabis type products, if they're prescribing pain medication, it is not good to have it come out someplace through a blood test or something like that. That's one thing to be careful of. And the other thing is exactly right. It's like, we don't know enough about combining cannabis with other pain medications. To me, it could it can cause other side effects that are something that you didn't plan with one and the other alone.
Right. But it's something that is really, it's kind of interesting how it's all plays together. They're coordinated. Deborah had a great question. Greg, you want to tackle this one? I think this is right in your wheelhouse.
Yeah, so I can see, well, one thing, you know, Deborah, at 70 years of age, you have to rule out other forms of sleeping disorders first before you start guessing at what could be going on and what medicine I should take. The idea is like, it's not always like the medicine to do exactly what you want, to sleep better and feel better. So it looks like they practice on you a bit. You've tried Ambien, which could have its own hangover effects. They've got lower doses. They got controlled release dosing of Ambien for longer effects. It's something that you be careful of. So if you ruled out all other sleeping disorders and any behavioral problems with sleep wake that might be going on, and then you can look, and if you are looking at like cannabis gummies and tinctures, you don't want to wake up in like 4 hours and then take another one. That's what something they told you with Ambien as well. So if you're doing something like that, it might be something along the idea of the inhalation route initially and the gummy, like at bedtime. And then the gummy will start taking effect, in a couple hours, hour, 2 hours, something like that, and may help you stay asleep longer.
Right. I think that using an edible like a gummy or chocolate, they'll have a longer onset. They have a longer effective use, meaning they'll last 6 to 10 hours, and that's what's really help you. The key is going to be how much. Don't take too much, because again, that goes back to what I mentioned earlier. It kind of brings back some of the problems that you're having. So take a look at really go low and go slow, and you should be able to find that sweet spot. Michael, I want to answer your question. I'm not suggesting to use CBD without THC. I made a comment about CBD, about the properties of it, but I always recommend using CBD with a little bit of THC because it really helps to activate. I look at CBD and THC working together as 1 and 1 or 3. So please take a look at it. That's something that's really there. I think, I hope I didn't confuse you. I recommend using CBD with a little bit of THC in there. Is indica recommended for sleep? I think it depends on your chemistry. I think having a product that is indica leaning, meaning that it'll have the myrcene, the humulines, and the caryophyllines, I think will help you quite a bit. Greg, your thoughts?
I think so too. I mean, that goes back to the whole anecdotal evidence thing where somebody will say it's sativa, gives you that happy, got energy feeling, and indica puts you in the back of the couch. I think they've all started there by looking at indica for sleep.
Mm-hmm. Greg, you want to tackle this sleep apnea problem? I think, again, that's right in your wheelhouse.
Yeah. CPAP every night, traveling overseas, all kinds of sleeping when I return to the USA. That whole idea of crossing time zones, especially when you're overseas, it's harder when you're traveling from, say, Europe back to the States, as far as jet lag goes, than going east. I'm not sure exactly why, but I know it will take like 3 days for every half hour or so to like get you there, as far as your circadian rhythm. But I always make sure that that you can use indica to like get back on a regular sleep schedule. Know that it's not going to come easy, and make sure that you're getting like bright sunlight in the first 30 minutes that you wake up for about 20 minutes in the first hour that you wake up, and also in the late afternoon, get another 20 or 30 minutes of bright sunlight to keep that circadian rhythm going naturally and try to get your brain back on the right kind of time zone that you're in. But the whole sleep apnea CPAP thing, that's just kind of an aside, it's just something else that you're using, but it really is the whole circadian phase that you need to focus on.
Yeah, and I traveled a lot internationally, and I think that time change is always tough. It's always tough for a lot of people, and you just got to kind of, like you mentioned, pay attention to getting back into your sleep cycle when you get back or to where you came from or where you're going. Let's put it that way. One of the questions is, does CBD with THC affect the brain and dreams? Greg, you want to take that one?
Yeah, and it does. The idea is like it delays REM onset. So any kind of cannabinoid will delay REM sleep onset. It usually happens after the first hour and a half after you fall asleep, may last like 10 minutes, another hour and a half later. You may have another REM episode that lasts like 20 minutes. And it goes like that towards the end. And the reason why we remember our last dreams is because that's our longest REM sleep period. But it does reduce the volume of dream state sleep, and it can also delay REM sleep onset. So it does have an effect.
Great. One of the other questions that Milton came up with is cotton mouth, where you wake up and you have dry mouth. He says he's tried both hybrid and indica RSO, and they both give you extreme RSO, extreme dry mouth. it's something that every person's body is different. And I think what's happening is that's one of the side effects of using, or how should I say, especially RSO. My recommendation would be is to try using a little bit less of it. I wouldn't cut it in half. I'd cut it down by about 20% and see what effect that has on your dry mouth. And I would only use RSO. I wouldn't use RSO and the hybrid together. I would simply use one of them by itself and see if that really doesn't help a little bit. You might be using a little bit too much RSO, and that's why you're getting the dry mouth effect. But again, as I mentioned, every person's body is different, and that might be an effect. I get a dry mouth effect sometimes. And again, it just has to do with the way my body works. And it's not comfortable, but it's something that I know is at least I know the cannabis is working and I'm getting a good night's sleep. Laura asked the question, how do you dose RSO? How long does it take to feel the effects, especially sleep? That has to do with the route of administration. That has to do with what you're actually, how you're actually taking it. I personally prefer to dose RSO using tincture oils. They're using tinctures. A lot of the dispensaries today are producing very quality tinctures, especially indica and sativa RSOs. You can purchase them at dispensaries, and that's the way I recommend using them, starting with 0.5 or 0.25 milligrams, milliliters, excuse me, and then going the first line on the eyedropper, the second line on the eyedropper, the third line on the eyedropper, and find out what really helps you there. RSO, however, in its native form, is a very strong concentrate that you get in a very small syringe, and you typically take about a grain of sand. I recommend that you put it on a cracker, put it on chocolate, put it on something that's easier to eat, and then taking it that way. And by the way, if you still have a problem with it having the negative effects, take a half a grain of sand. RSO is extremely strong. I call it the 151 Bacardi of cannabis. You have to be very careful with it about how much you take, but it is extremely effective at helping things like sleep, pain, inflammation, PTS, that type of thing.
Hey, Mark, can I go back to Milton's question?
Sure.
One thing, Milton, is it may be that those medications are causing you to sleep with your mouth open too. I'm not sure, but and that'll certainly dry your mouth out, along with the medication effect, that Mark was talking about, like reducing the dose. But you can try this artificial or synthetic saliva that you can get online, and consider trying like something like a chin strap. A chin strap is just like elastic and Velcro to help keep your jaw from just flopping open. Along with that artificial saliva, it might help you.
That's a good question. That's a good thing. Laura, when I'm answering your question, I've talked about a grain of sand. Some people talk about using a grain by way of rice. About small. The reason I brought up a grain of sand is because it's smaller than a grain of rice, and you may want to start with that smaller dose, start off with, and see how that affects. It will help you sleep. But again, I'm talking about the reason I brought up the sand versus rice thing is because I want you to understand, go low and go slow. You'll find the right amount. If you're using the concentrate, it's in a syringe. I prefer to use the tinctures because I think they help quite a bit. That's there. We have some questions that were asked prior to the webinar. You submitted them. Let's kind of run through those, Greg, if we can. I think we talked about what products are best for sleep. You'll get a copy of the slides. And again, those cultivars are the ones that you want to look at. My recommendation is let's look at the products as look for the right terpene profile: myrcene, beta-caryophyllene, humulene, and then I also recommend that you look at other things like linalool, because they'll help you quite a bit with that. What strain is best for sleep? I think, Greg, that really depends on who you are. Every person's body is different. Is that correct?
Yeah, exactly. So, working with the guy behind the counter, that's where you should start. Ask him for his recommendations, and then just, start with a low dose, see how it's working, because they might change the profile at some point if they move up to a certain dose and it's still not having the effect. It's saying that we do with Western medicine. It's like changing things, changing dosages to find out what works the best for you.
Yeah. I know that 9-pound hammer is very effective. It's not necessarily available at every dispensary, but they also have one called 5-pound hammer out now, and you might want to take a look at that. It can be very effective. Some dispensaries have that. One other question is, what kind of route of marijuana do you use to help to fall asleep? Again, it depends on what you like. I personally I take a little square of chocolate. I take an edible that helps quite a bit. But again, other people much prefer tinctures and other forms of administration, like a capsule, a CBN capsule, for example, 2 hours before bed. Greg, your thoughts on that?
Now, I've only had like a limited experience with it, and that's why I knew that the vape pen worked. So without lung
Mhm.
disease, that is like what I found is like a wow. It worked like like no medication that I had seen before when you're not undergoing anesthesia. So I thought that was really
Sure.
a wonderful way to use it.
Yeah, vape pens will help you fall asleep. There's no question. The only issue there is it only lasts for 2 to 4 hours. That's why using a vape pen with a edible like a square of chocolate will really help you carry you through the whole night. What the other question is, what time should I take a gummy before going to bed? I recommend 2 hours before you go to bed. Give the edible time to work. I think that's what's really important. I think that a lot of people will take a product, especially a gummy. If it doesn't work in 10 minutes, take another one. And I think at that point in time, you may be over taking way too much. And going back to what we mentioned earlier, it gets that biopic effect where it's going to not give you what you want. It's going to cause the opposite of what's taken there. When you're using edibles, gummies, be cool. Just go slow and start with one and wait an hour or two and before you take another one. It says indica makes my body totally relaxed, but keeps my mind racing and awake. Greg, have you ever run into people that have a relaxed state but have a racing mind?
Yeah, we try to go through some different cognitive behavioral therapy techniques for people that have that, racing mind kind of thing. It's a relaxation phase, top to bottom. Start like contracting your muscles from the toes all the way up to the head. Contraction, relaxation. You can write down things that are on your mind, like a half an hour before bed, to say that you've addressed all these things that are on my mind. Sometimes it's that rumination of going over things over and over that keeps people from falling asleep naturally. But always remember that you have to have enough sleep pressure built up during the day. So even if you fell asleep for just seconds, it could relieve that pressure to fall asleep.
Yeah. Um, let's see. Next question we have, Lee, is how do I find the right ratio for 8 hours of uninterrupted sleep without trial and error? I wish there was a good answer for that. There really isn't. You really have to go through the trial and error. Every person's body is different, much like caffeine and much like alcohol. I have friends who one drink, they're done for the night. I have other friends that when they finish the bottle, they're just getting started. Same thing happens with cannabis. It really just depends on how do you find your ratio. Now, I will tell you, if you start with a go low and a go slow strategy, especially if you're using a gummy or a tincture, it only usually takes about a week, maybe a week and a half at maximum to really find your sweet spot. You'll find it very quickly. It's not something that's going to take forever. I don't want to give you the impression it's a long, drawn out process, but it will take a couple of days. And I do think that you're unfortunately going to have to go through that because, again, like alcohol and caffeine, I can't tell you how your body reacts to it. Your body will tell you. And as you're beginning to feel better and better, you can increase the amount of product that you're taking and then find out what's there. I do recommend maybe increasing the amount of CBD because that'll help you be able to get some sleep. How is the best way to increase and decrease your dosage for sleep depending on how much THC you ingest during the day? Again, that depends on your route of administration. I mean, the easiest answer is just take less of it. But I do think that if you're using THC during the day, what form of administration are you using? Again, every form of administration, like vaping, has a 2 to 4 hour onset time. Effective dose time. If you take a look at capsules, they're like 8 to 10 hours. Same thing with gummies. They're fall in that category. So I think the best way is just to be able to know if during the day you're smoking a joint. A joint lasts about 2 to 3 hours. So really, I wouldn't worry about it after 4 or 5 hours because typically your system has already used or passed a lot of that. I think the best way is just to concentrate on what you're doing before bed and pay attention to the dosing and go low and go slow on that. Greg, any thoughts you have?
Well, depending on what you're using the THC for during the day, of course, on why you're using that much. But again, it goes to that receptor suppression. that if you're down regulating all your CBD receptors because you've got so much of the medication drug in your body all day and you're looking for it to have some effect at night, you've got to control some of that if possible, and still look at sleep hygiene as to be your best friend to like get the best sleep during the night.
Mhm. Right, right. How do I dose a portion of THC, CBD, and CBN for sleep? Does medical marijuana before bed time affect time spent in REM and deep sleep? I'll let you answer the second part of that question, Greg, but I want to answer the first part. On your COA, certificate of authenticity, it'll tell you what's in the product you're taking. Again, how much THC, how much CBD, and how much CBN. I think for sleep, you want to have a higher dose of CBD than THC. You may have, for example, you may want to use a 4-to-1 product for CBD to 1 THC. And of course, the CBN that's in there is non-euphoric. So you may want to take a look at, again, keeping that in the realm of the same amount that you're taking with CBD. Again, a lot of times CBN is sold by itself or also sold with CBD and THC products. Check the ratio on the label that's there. But Greg, one of the questions is, does medical marijuana before bed affect your time spent in REM and deep sleep? Why don't you take on that one for us?
And the short answer is for REM is like we've covered, it does affect how much time you spend in dream state sleep. And keep in mind that REM sleep is important for psychological health. But the idea is that for acute forms of insomnia, it's okay as long as you know everything about that sleep pressure that builds up through the day and the circadian phase that you're on when you try to get to sleep, and you're not doing it all the time. But if you've got chronic forms of insomnia, either sleep onset insomnia or wake after sleep onset insomnia, then it's time to seek a real clinical sleep specialist to sort of help you figure that part out. And deep sleep, things like alcohol can give you increased deep sleep. But the problem is once the liver starts metabolizing the alcohol, you'll start having more arousals during sleep, and it will undo all the effects of getting better deep sleep. So you feel fatigued during the day. So some things like that, you have to take the good with the bad, but you have to watch out why you're using it and how you're using it. And if you're not sure, you've got to talk to somebody in sleep medicine.
Sure. The next thing is the patient has IBS, and they microdose because they wake up every 2 hours. He has to microdose because he's waking up every 2 hours. If THC is irritating your stomach, what you might want to do is take a look at a higher ratio of CBD to THC product that can really help you quite a bit. And I would pay attention to how much you're taking, because if you're using a little bit more CBD than THC, it might give you the same relief without irritating your stomach. You would really need to be able to adjust your dosing, and hopefully your medical marijuana doctor can help you with that. But my recommendation would be add a little more CBD to your regime, continue to use THC. You may want to cut down on the amount of THC and see how that affects your, whether it reduces the amount of irritation in your stomach. It might give you a little bit longer sleep. Any thoughts you have on that?
Yeah, the timing of this nocturnal awakening has me concerned, because it sounds like, it could be a REM related kind of a problem, like REM dependent sleep apnea or something like that. So if I was this person, I would talk to their primary care doctor and say, I think I might need a sleep study, either a home sleep test or a test in a laboratory, to rule out this REM dependent sleep apnea, to see if that's what's causing you to be awake and you just think you're having an insomnia problem and you're looking at dosing it higher or lower. I mean, I think it's REM dependent sleep apnea.
Right. We do have some other questions that have come up. Here we are. Milton has a question. If you wake up after 4 to 5 hours and can't fall back to sleep, would you take another dose to get another 4 to 5 hours? Milton, let me answer it this way. One of the things about dosing is what they call coverage. In my particular case, because I have herniated discs in my neck, the pain isn't going to go away. What I have to do is I have to reduce the inflammation, and I have to control the pain. So I'm on a regime that I take it medical cannabis in the morning, then I take it in the early afternoons, I take it in around dinner time, and then I take it before bed. Because if I don't do that, the inflammation will come back, the pain will come back. So the answer is yes, take another dose. If you're taking tincture oils, your tincture oil might be, your tincture might be working 4 hours, maybe 5 hours, and you basically, your body's looking for more of the cannabinoids to help it produce what you need to do to get to sleep. I think that's what you're finding that's right there. I don't know what route of administration you're taking, so that's why it's hard for me to answer this question. If you're taking a gummy, I don't recommend taking another one, but if you're taking a tincture, I would. And if you're trying inhalation, I definitely would try that itself. Carrie asked the question, is a vape pen safer for smoking flower in a pipe from a lung damage perspective? The answer is yes. Smoking flower is great with a pen, with a pipe, but if you use a concentrate pen, and especially if you can control the temperature, meaning you're setting the temperature on that vape pen to be able to get the maximum terpene profile from it, it'll be a lot safer on the lungs for doing that. I don't know, Greg, do you have any comments on that you want to make?
Yeah, there's a lot of other byproducts whenever you're putting fire to the buds, to the flower. And it's like a cigarette. It's got 600 different compounds in it that you're putting into your lungs. But when you've got that kind of like particles and things that go into your lungs, those small alveoli, the air sacs, can actually start to get clogged up, wall off, and could cause problems. Now, the vape pen, is it completely safe? No, because it still is a chemical and it's still going to the lungs, and it may have less of effect as far as lung damage goes. But if you're just using it for acute forms of insomnia here and there, it's fine, and it's not going to do that kind of damage to you.
Right. Michael had a great question. It says, I have cannabis, which is 1 to 2 years old. Could this be a problem to use? It really may not be a problem to use. Cannabis doesn't become toxic. It does not do that, but it may not be effective. You're going to probably reduce the amount of effectiveness that the product may have. I would just, if you have a product that's a little bit that old, just pay attention if you do use it to what effect it has on your body, because again, it may have lost its efficacy, may not be working anymore, and that's the only thing that you really have to worry about there. Angelina had a really great question. What is the difference between Delta 8 and Delta 9, and which is better for sleep? The main difference is there is a slight alteration in the makeup of the cannabinoids in both of those. Delta 8 is not as strong as Delta 9. Delta 8 is not found in quantities that you'll find in Delta 9. You'll find in cannabis, it's easier to find Delta 9 than it is Delta 8. Delta 8 is hard. Most of Delta 8 is extracted from hemp oil and being able to introduce that way. Which is better for sleep? Again, it depends on your body and who you are. I don't want to give you a definitive answer, but I do know that if you're taking a look at sleep, Delta 9 usually gives you a better result. And again, that's just, anecdotally what people find out. But again, your body will tell you which one works better than the other. I am not a big fan of Delta 8 products, primarily because they have research as much as Delta 9 products. So I would stick with the Delta 8 side that's out there. Last set of questions here, Greg, we want to take on. I think we covered CBN. I think the question is in dosage, it really depends on which route of administration you take, whether it's a capsule, whether it's going to be in a inhalation form, or whether it's going to be a tincture. But CBN is very effective. And when you ask, will you be mentally and physically tired or foggy the next day? It's one of the advantages CBN should be, but again, it depends on your body. Greg, any thoughts on that?
Well, those are some of the more common side effects of CBN as well. I mean, they're looking at things like diarrhea, nausea, some of the standard things that come along with any kind of medication, but that hangover effect kind of thing is something else that's been reported on CBN.
Right. The other question is, are there methods for better sleep besides THC and CBD? Greg, I think that falls into what you do.
Oh yeah, I would always start with sleep hygiene, cognitive behavioral therapy. Make sure you're doing the right things for the best kind of sleep that you can get. And then if it's not feeling good, if you've done everything right, just look up sleep hygiene on the internet, and it'll put out 20 different things that you could do better. But once we've exhausted everything, looked at everything that that we could do that way, even with a sleep diary, things like that, then it's time to look at like a overnight sleep study, sometimes formally in a laboratory if there's comorbidities, and then on to medications or some other form of therapy.
Right. Right. Great question. Granddaddy Purple works best for me, and it's impossible to find. Why are they mixing up the strains and not growing the ones that people already use? The big issue with cannabis is it's a botanical product. It is grown either outdoors or indoors. I know a lot of dispensaries try to grow indoors because they can control it, but there's still a lot of cannabis grown outdoors. The biggest problem is being a botanical problem, much like tomatoes, lettuce, fruits, they all have seasons. And so it's not that they're not trying to grow them. What they're trying to do is they're trying to find the right season for them and being able to grow them. And that's why indoor grows are usually a little bit better to be able to produce the products. I would say it's probably a combination of you're running into a dispensary that grows outdoors and it's just not that season. Or the other problem, which I have found, is that the indoor people that are growing with indoor dispensaries, they run out of product. Usually products that get very popular, get sold out very quickly. So you might want to tell your dispensary that's what you're looking for and to notify you when it comes in, because that might be one of the problems that you have. It's not it probably will still be there, but it probably isn't going to be found. I would say if you can't find Granddaddy Purple, try OG Kush. OG Kush will work very well for you, and might want to see if that works. What is the impact of medical marijuana if you are on SSDI, Social Security disability? You should be able to take medical marijuana if your state recommends it, but you always have to be very, very careful because obviously Social Security comes in a federal level. So
Yes.
the point is you should be covered, but I would be very careful and discuss this with your doctor before heading down in that direction. Greg, your thoughts?
Yeah, absolutely. It's a federal program, Social Security disability, and you don't want to risk losing that because you smoked a joint or even tested positive for anything. So you have to be entirely aware of what the regulations might be for it. And you may unfortunately have to go on to like traditional medications for things like insomnia.
Yeah. Yeah. I think just be careful. Again, we don't want to recommend anything that gets you going south of the federal regulations, but it's kind of interesting because those regulations are also changing, are going to be changing. Hopefully in the next few years, we'll find out. Is less marijuana better for dosing? And I think the answer is yes. Go low and go slow. There is, again, that biopic effect. We'll be talking about dosing in a couple of weeks. As you take it and you begin to feel better, you're going up this curve that you're feeling better. And then when you get your sweet spot and you start taking too much, the effect that you're trying to get rid of actually can come back. So I would say, yes, go low and go slow, but you can't increase it. You can't increase it to where you begin to feel good. When you begin not feeling good, then back off. That's when you'll see that's really there. But I think the answer to the question is yes. Greg, this is a great question on the next one. I was told to be cautious with medical marijuana because I have a pacemaker. It says a pacer or pacemaker. The answer is yes. Anytime you're dealing with blood and the heart and medical cannabis, because medical cannabis, again, is distributed through your body, through your bloodstream, you typically have to work with your medical marijuana doctor as well as your medical doctor and probably adjust the dosing, probably down a little bit less on each side. Greg, do you have any thoughts on that?
Yeah, he has to keep in mind why he had a pacemaker placed. He had trouble with the myocardium, and either the atria or the ventricles or both. And because they are like a muscle tissue, and medical marijuana could have an effect on any cannabinoid receptors that might be on the cell walls of all of that. I'd be very careful, and I wouldn't do it unless I was cleared by cardiology by everybody.
Yeah, I think that's a good point. When you're using like a pacemaker or you're doing anything that has to do with blood thinners, really pay attention, really get your doctor and your medical marijuana doctor involved just to be on the safe side. I think it's always better to err on the safe side that's there. Last question that we have is, it says, I take tincture every night. Are there any potential negative long-term side effects from this? I've looked at a lot of medical journals, medical cannabis journals on this particular subject, and I haven't really seen any credible study that has indicated any long-term effects. In fact, if anything, kind of indicated the opposite of that, that it's helped your body quite a bit to be able to overcome whatever condition that you're trying to address. I'm not aware of any potential long-term effects that are out there, again, based on studies or anecdotally. Doesn't mean that it isn't, because we're still studying cannabis and we're still in the early stages that's out there, but it does mean that it is a fairly safe product. That's one of the reasons why people use cannabis versus pharma drugs. It's a lot safer to use a cannabis product than a pharma drug. Greg, your thoughts on that?
Yeah, and you said it really, really nicely. You put it nicely. The idea is that you have to take any medicine chronically for a long period of time, then you have to look at underlying causes to see if that's something that you need to be doing. But even like a drug like Ambien, Ambien has been shown to be safe long term. But still, you know, if there's something that you're doing wrong that you could do better as far as your sleep-wake cycling and your sleep health, then I would work on that while you try to back off of the tincture.
Sure. Well, Greg, we covered a lot of questions tonight. We covered a lot on sleep. As I mentioned on these webinars, if just one person can watch these webinars and can help them get their life back and they can have a better quality of life, then I think we've been successful, and hopefully this is there. You can actually take a look at MMTC if you're looking at getting your card, medical marijuana card. If you're looking at CBD products, we have My Botanical Wellness. And I think, Greg, you have a sleep center in, is it Houston that you're located in?
Oh, no. I'm working with ALS patients in Houston and long-term ventilator care right now.
Okay, great. Yeah, but there's a number of different locations we can go to help you find the resources that you need that are out there. I do want to also mention that sleep is very important, and you'll be getting a copy of this video, a link to a video on YouTube. You get a copy of the presentation. You'll get information like the card Greg was showing you on how to adjust your sleep. You'll be getting all of that from us in an email that's coming up. Greg, do you want to have any final questions? I know we've been at this for about an hour and a half.
You know, we covered a lot, but everybody that was involved as a participant, you can get in touch with Marc, and he can send questions to me. We're available to answer questions the best we can, but you know, in doing your own literature search to see what's going on, maybe we can help explain things a little bit better.
Yeah. So hopefully that helps. I do want to mention next week we have a webinar on terpenes. I think that's important. Terpenes are absolutely critical to the key to medical cannabis. And then of course dosing the week after that. And next quarter, we're excited to announce that next quarter we're going to be again another series of webinars. We're going to change the format a little bit, make it a little easier to access the information, and we'll be announcing some things in a couple of weeks that we think are exciting. Greg, thank you for your contribution tonight. I know that you've helped quite a bit. Last comments?
Medical marijuana certainly has a place in insomnia and a lot of other things that are going on. So I'm happy to take part in this.
Great. Well, listen, thank you everybody for tuning in tonight. We really appreciate your patience. I know this goes long, it's a long webinar, but hopefully there's a lot of information that really it helps you. Next week, we're getting into terpenes week after dosing. Please join us. And again, thank you very much. And Greg, I want to give you a shout out. Thank you very much for helping in the co-host. Great comments. I also want to mention for Lee and Leah, who you saw in the background helping with things. Thank you for what you do. And of course, always a shout out to Alyssa Katera, who came up with the idea of making this all happen. Listen, everybody be safe, and hopefully we'll see you next week. Thank you for joining us.